So good afternoon, everyone, and welcome to our Alts Educate series. My name is Andrew Howe, and I'm the Education and Engagement Coordinator for African Nova Scotian Communities at the Alzheimer's Society of Nova Scotia. And we're excited to be able to connect with you and learn with you today. If you're experiencing any troubles with the connection or on Zoom, just send a message to ASNS Zoom support and through the chat box, and they'll be able to connect with you to troubleshoot any issues that you might be having. For today's session, all participants have been muted and video turned off. And so with these privacy measures in place, we'll be recording the session for future use. And so if we can get the next slide. So as we begin, I'd like to acknowledge that we are in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq Nation. The Alzheimer's Society is committed to undertaking work to create collaborative and respectful relationships. And together, our goal is to identify and develop tools that align with the beliefs and the needs of Indigenous, African Nova Scotian, Acadian, and all equity-seeking communities across our province. Next slide. And at ASNS, we're working towards becoming a more diverse and inclusive organization where all Nova Scotians feel a sense of belonging. We use the acronym IDEA, Inclusion, Diversity, Equity, and Accessibility, to apply a person-centered lens to our work and ensure we are fostering a sense of belonging in all that we do. And to facilitate this work, we're grateful to be collaborating with the partner organizations that you can see highlighted on this slide here. We'll go to the next slide. I just want to highlight that with this session that we're doing with the recorded session, all information the property of Alzheimer's Society. Take note of the date of the session that we're doing. And if you need more information or up-to-date information, feel free to reach out to us at the number listed. And we'll go to the next one. And so this afternoon, we'll have a 35-minute presentation followed by 15 minutes or so of Q&A at the end. So please feel free to ask questions using the chat box, and you can send those to the hosts and to the panelists, and we'll review the questions and share them at the end with our guest speaker. And make sure you remember to press send on your question once you finish typing it so that we receive it. And so today's presentation is the experience of Black Canadians living with dementia and their care partners in providing care. It's my pleasure to introduce our guest speaker, Dr. Ingrid Waldron. So Dr. Waldron is a professor and the Hope Chair in Peace and Health in the Global Peace and Social Justice Program at McMaster University. She's a health sociologist whose research focuses on the health and mental health impacts of racism in Indigenous, Black, and other racialized communities. In 2024, she completed a study on the experiences of Black people living with dementia and their care partners in the Greater Toronto and Hamilton area, and that's what we're going to hear about today. As a follow-up to that study, she's currently conducting a digital storytelling project that includes short videos on dementia in Black communities. Ingrid's research also focuses on mental illness in the Black community, COVID-19 in Black communities, and the health and mental health impacts of environmental racism and climate change devastation in Black and Indigenous communities. Ingrid is the author of There's Something in the Water, Environmental Racism in Indigenous and Black Communities, which was turned into a 2020 Netflix documentary of the same name and was co-produced by Canadian actor Elliot Page and Ian Daniel. She's also the founder and director of the Enrich Project, the Environmental Noxiousness, Racial Inequities, and Community Health Project. and co-developer of Canada's first environmental justice private members bill, which became law in 2024. That's Bill C-226. So without further ado, Dr. Waldron, the floor is yours.
Thank you very much. Thank you, Andrew Howe, for inviting me to do this talk. As was said, this presentation is based on a study that I recently completed on Black Canadians living with dementia, living in the home with their care partners. And I'm also interested in the experiences of the care partners in taking care of Black folks in the home. So studies have been showing over the past several years that African Americans and also Black British people have disproportionate share of cardiovascular risk factors for dementia. These studies have also been emerging for over 30 years in the US on the experiences of care partners who provide support to Black individuals living with dementia. The tradition of family care, of course, is a powerful force for African American dementia family care partners, and family care is also a powerful force for Black people of the diaspora in general. We tend to take care of people in the home, our family members in the home. African Americans tend to have lower rates of institutionalization and lower desires to institutionalize than white populations. We're less likely to put our family members in nursing homes and other institutions, preferring instead to take care of family members in our homes. So this is what I'm going to look at in this presentation. And what I looked at in my study, I wanted to look at home care by Black family members. So the study I'm sharing with you today comes out of my own personal experiences with dementia. I was a care partner for my mother, who was diagnosed with Alzheimer's disease in 2016 and unfortunately passed away December 27th, 2024. I took care of her in my home. Of course, I had some care partners. I had PSWs, but I was her main caregiver. While I have been told that my study is the first study on dementia in Black Canadian communities, there is emerging evidence that strongly suggests that Black populations in Canada have a higher occurrence of dementia compared to other populations, while at the same time experiencing gaps in culturally responsive care and adequate supports. In the recently released report, so this came out last year and it's the first of its kind. It's called The Many Faces of Dementia in Canada, focusing on racialized individuals and Indigenous people, indicating that in the next few years, they will have the highest rates of dementia, unfortunately. That includes Black people, Indigenous people, Asian people, and South Asian people will have the highest rates of dementia. And this is documented, as I say in the report, The Many Faces of Dementia. It notes that there are three main reasons for Black people and other racialized groups being at greater risk for developing dementia. One is potentially modifiable risk factors, such as poor diet, alcohol intake, lack of physical activity, and obesity. The next is the social determinants of health throughout the life course, such as racism and low income. Differences in biomarkers would be the third. So this causal factor is more biological. So there are differences in biomarkers in the brain connected to dementia risk. For example, Black populations have a higher rate of the E4 gene compared to white populations, which puts them at a higher risk for dementia. So what is the rationale for my study? Well, the main rationale for conducting my research pertains to the dearth or lack of research and literature on dementia in Black Canadian populations. I believe this will change. There are a few people I know who are interested in this topic. But right now there's a real dearth, and there's, forced to look at the literature in the United Kingdom and the United States to look at what's happening around dementia for Black people. So much of my literature review was based on what's happening in the US and the United Kingdom. Unfortunately, I couldn't find any studies in Canada. So these are my study objectives. The first one was to examine beliefs, perceptions, and attitudes that diverse Black Canadians living with moderate dementia in the Greater Toronto and Hamilton area hold about the illness. I wanted to know about their beliefs about dementia, their perceptions, and their attitudes. As somebody who studies mental illness, I know that a lot of Black people have specific beliefs about mental illness. There's a taboo in Black communities around mental illness, and I wanted to know whether or not there was a taboo around dementia in Black communities and what the general attitudes were. Um, yeah. And the second one is to learn about the experiences of diverse Black Canadians. And when I say diverse Black Canadians, my intention was to look at this from an intersectional perspective. I wanted to look at issues of race, gender, class, gender identity, sexual orientation, and immigrant status. So I tried to get a diverse group of Black people in terms of recruiting them for the study. So I wanted to learn about the experiences of diversity around the different Black populations in the Greater Toronto and Hamilton area. I also wanted to gain an understanding about the supports they use and the community activities they engage in to maintain and enhance their health and well-being. Next, I wanted to examine the experiences of their care partners, right? So this is also about the experiences of their care partners, and the funding specifically wanted to be to look at some of these issues in the time of COVID, because they wanted to look at mobility issues and the ability of care partners and people with dementia in venturing out of their homes, particularly during COVID. And finally, I wanted to use the data from objectives 1 to 4 to produce, as Andrew said, a short documentary, a digital storytelling project on dementia in Black communities in the Greater Toronto and Hamilton area. I thought, I'm somebody who does a lot of filmmaking. I like to do film or documentaries. I think it's a very great way to share findings, but it's also a great way in this case to get the conversation started, because I believe that Black communities are not sufficiently engaged in the conversation on dementia. And if I were to do a presentation, for example, and go somewhere, maybe I would show the documentary first and then I do a presentation, but it's a way to get people talking. The documentary is still filming at this stage. So who are my sample? As I said earlier, a diverse sample of Black folks, and I had a total of 24 participants using a dyad approach, meaning the participants who had dementia that I recruited um, were being cared for by the care partners that I recruited. So I had 12 Black Canadian individuals living at home in the Greater Toronto and Hamilton area with moderate or middle stage dementia. And why? Well, I wanted moderate or middle stage because they needed to speak clearly and coherently during our interviews. Because I wanted to document, of course, the interviews. So I wanted people with moderate dementia. I also had 12 care partners of those people with dementia that I recruited, who provided support to them in the home. So this was basically mimicking my own experiences, because I took care of my mother in the home. I wanted to hear about their experiences. This support that they provided to the person with dementia may have included help with the activities of daily living, such as dressing, bathing, toileting, walking, etc. The methods, 24 in-depth one-on-one interviews were conducted with everyone. And then they were analyzed using in vivo analysis, which is a qualitative software package that finds themes in the data that has been transcribed. So a transcription approach was used, and the transcription was then used to identify categories and themes using in vivo software package. So there were many findings, but I can only share with you a few of them. And the first one was about changes in activities. So before I begin, you may notice that some of the issues that I'm talking about, some of the findings, are shared by other cultural and racial groups. And that's fine. I think the point of my research is that we need something documented about Black Canadians, even if some of their experiences are the same as other groups. Having something documented, having research, having publications is really important because, as I said earlier, there's a dearth of research on Black communities. So the first one was changes in activities. The care recipients, I'll use that term often, the care recipients are the people with dementia. They had increased difficulty resuming their routines. This includes driving and taking medication, and it certainly could include dressing themselves and being able to eat with both hands, particularly, and other behaviors. There was also an increased dependency. Care recipients relied on the caregivers to perform those daily life activities, which was problematic for many folks living with dementia. Changes in their identity. Participants experienced self-perceived changes in their own personality and identity, which of course is normal. When you get dementia, your personality can change. There could be mood swings. Your emotions can be up and down on any given day. You could feel depressed or erratic. So that's normal for dementia to have a change in their identity. But what's important is that the care recipients noticed that change in their identity. There are also changes in cognition. Of course, this is a common feature of dementia, particularly memory loss, was the most discussed symptom of dementia. I think in popular culture, in film and TV, when dementia is depicted, that unfortunately is overwhelmingly the aspect of dementia that's shown, memory loss. But after going through dementia with my mother, I realized that there are so many changes that happen. Memory loss is one of them, certainly, but dementia is so much more than memory loss. So the progressive memory loss, I think what's often said about dementia is that the person who has dementia can remember what happened 20, 30 years ago, but they can't remember what happened yesterday. So that sometimes happens as well, where they can remember things that have happened to them decades ago, but can't remember yesterday. But I would say progressively that changes a bit to where they're not able to remember anything from the past. And I noticed that with my mother. She was not able to remember eventually anything from 20 years ago, where maybe before, months earlier, she was. There was also changes in social bonds, introversion, and impairment in cognition, like forgetting names, affecting the care recipients' social bonds. Introversion is an interesting one, something I noticed in my mother. My mother and I had a very close relationship. We would often be in bed together watching TV, joking and laughing. And during mid-stage dementia, I just noticed that she was kind of cut off from me emotionally, not speaking to me, seemingly in her own world. And that was the kind of introversion I noticed in my mother, that I realized that she indeed had dementia. She wasn't like how she used to be. We would chatter and we would talk and we would joke. And I would be right in the bed next to her watching TV and making comments about what was on TV. And she was in her own world like I wasn't there. So that's kind of a natural progression of dementia. There's also sadder mood. Some care recipients discuss feeling sadder or more depressed. Many of them compared it to depression. Once again, something that I did notice with my mother. My mother was someone that everybody loved. She had a special talent. People met her and loved her immediately. People who didn't know her loved her. She had a bright, sunny personality. I never saw her depressed during my childhood or my adulthood. When I was 14, I went to the kitchen and I said to my mother, I said, Mom, do you ever get depressed? Because I thought I've never seen her depressed. And she looked at me and she said, Ingrid, what would I have to be depressed about? And I thought, wow. But when she got dementia, I did notice low mood, which was strange for me because she was an up, joyous, bright, loving person, but she had definitely sadder mood and she seemed very reflective at times. To this day, I don't know whether people who have dementia, maybe somebody knows, know that they have dementia, know what's going on with them. But I think they feel changes, right? I think they feel changes in them, but they don't know quite what it is. And the sadder mood is I think part of that as well, feeling more depressed. They also discussed intersectional, sorry, they discussed a stigma as well with respect to prejudice. Some care recipients express being treated differently by other people. So many of the respondents, many of the participants in the study talked about a sense of stigma that they were feeling from other people, that because they had changed a bit, other people had changed towards them. And that was tinged with a bit of stigma around the disease that they now had. They also talked about intersectional discrimination, prejudice against dementia adds to the racism that they already experience, creating a different experience than people living with dementia from other ethnicities. So that intersection of racism and dementia was particularly challenging for many of them, that we call intersectional discrimination in the study. So I want to get to coping strategies. And the first one is the self-help strategies that some recipients discussed. Some care recipients compensated for their memory impairment with strategies to recall information. For example, by using Post-it notes. And that's very interesting. When my mother was in mid-stage dementia, she was living near to my sister in Ottawa. And when I went to her home, I noticed Post-it notes that my sister had put over her bed to remind her to call her doctor, to do the groceries, to do different things. It was a way to cope with the dementia, right? So the Post-it note approach, telling her what to do, was helpful during mid-stage dementia, where she was still functional. She was still able to walk at that point and to go to the groceries and to go out with her care partner walking and to go to the doctors, but she had to be reminded to do some of these things. They talked about therapy as well. Some care recipients expressed the importance of therapy, which helped them to come to terms with the diagnosis. For those who wanted to seek therapy, it was helpful to many of them to discuss the changes in their life and the sadder mood and the depression that they were now experiencing. I now want to get to competence and services because in our study, we wanted to know whether services were culturally competent for Black people with dementia. And we looked specifically at cultural and racial competence. And many of the participants felt that medical services that they received were culturally competent, which is great. They sensed that the doctors cared about them, that they were getting good care. So it was great to hear that. And this was associated with the medical professionals having the same or similar background. So basically, they were saying, yes, I did receive good care, but I would have preferred if that medical professional had a similar background to me. Some of the participants who had dementia that we recruited were from various African countries. and mentioned that part of that cultural competence is having people who look like them, people who had a similar cultural background. That was also important to them. Um, they also talked about dementia wise competence specifically. Health practitioners who treated patients in a kind and patient manner were acknowledged by the care recipients. And that was also very good to hear. A lot of people said that I got really good care. I got good care during COVID, and I'm happy once again. But the only thing that's missing is it would have been nice to see more medical professionals who are from my background and from my culture, who understand me and who get me. So in our study, we had many suggestions that came out of the words of the persons with dementia and the care partners. So these aren't necessarily my suggestions, they're the suggestions of our participants. So the first one is health practitioners with similar backgrounds. So participants discussed, as I said earlier, the importance of Black health professionals providing care to Black care recipients, and services to be more culturally competent. Once again, many of them felt that it was cultural competence was good, but they felt that part of that cultural competence was having medical professionals who were from their same background. They talked about more dementia-focused programs. Many of them expressed that more services and programs targeted to people with dementia should exist. So they're talking about programs in the community. They didn't feel that there were enough. And certainly fewer culturally competent programs where Black people may feel comfortable in various spaces. That was also important. They talk about dementia awareness in the community. They discuss the importance of dementia education in the general population and in Black communities in particular. I know that different Alzheimer's societies and associations have very great online education. So I commend that. I've watched some of those webinars in the past, and I think it's great. I enjoy them. I think what we're talking about here is more education in the community. And I would say for Black folks who are dealing with dementia, where there's maybe some stigma and lack of education, because we don't tend to talk about dementia perhaps as much as other populations, that awareness and education is really key for Black folks. And I think what would be great is if organizations, Black-led organizations, for example, in Nova Scotia, that are not in the dementia space, start looking at dementia, right? So in Hamilton, there is the African Caribbean Association of Hamilton. They are not a dementia organization. They are just a community organization providing programs and services for young people, for children, and for seniors. And what they're starting to do is to look at dementia, even though they're not in the dementia space. So I think what's really would be great is if organizations, including Black-led organizations in Nova Scotia, who are not in the dementia space, start looking at dementia as one of the services and programs that they build for Black communities. This topic of dementia is just not talked about in Nova Scotia, certainly not when I was there. Not enough in Black communities and not enough by Black-led organizations. I now want to talk about knowledge mobilization. And in academia and elsewhere, knowledge mobilization speaks to the importance of sharing your research findings and your knowledge in multiple ways to multiple audiences. And I'm starting to do that. So I've done a few presentations now. Let's see. Yeah, I've done a few presentations and workshops in Toronto and Hamilton and online to share these findings and engage participants in conversations on next steps. One presentation I did that I was happy to do was at the Center for Addiction and Mental Health That's CAMH, which is a very renowned agency that looks at mental illness in Toronto and Ontario. And there was a good crowd there, and I was happy to do that presentation. It was my first presentation after my study was finished, and there's a cohort of individuals there who are engaged in dementia work. So I'm hoping to connect with them in the future to move my work forward. And I did workshops, in-person workshops as well in Hamilton and in Toronto to engage the general population to create awareness about dementia. So I will continue to do presentations and workshops on dementia. One place that I'd like to do it is Black churches. It's important to go where Black communities go, right? Black people tend to be church goers, and it's important to do those presentations in spaces where you're going to find a large group of Black individuals. So I'm looking at a very popular church in Hamilton right now, where a lot of the Black community attends, to do a talk there at some point. And then I'm going to look to Toronto to look at some of those churches, particularly because dementia impacts older Black folks. But as many of you know, not necessarily. We have something called early onset dementia, but in general, it impacts elderly Black folks, and lots of elderly Black folks are churchgoers. So I'm trying to identify those spaces where people with dementia might go to, or their family members might frequent. So that's very important. I also have shared the final study report with different organizations. Many Alzheimer's associations in Ontario, I've shared the report. I've shared it with CAMH. I've shared it on social media. I've shared it with other health professionals after the study was completed and the report was written. Let's see. And I'm also currently writing with some of my research staff journal articles on dementia. As I said earlier, there are almost no studies on dementia in Black Canadian communities. That means that it's important to publish, very important to publish. So Black health professionals and other folks have something to work with, and that's scientific articles. So a few members of my team are leading the writing of articles on dementia currently. We're co-authoring articles on dementia based on our study. Another initiative I'm very interested in and excited about, and Andrew is also involved in this, is a study by Laura Middleton. Laura Middleton is a professor at the University of Waterloo, and she has a study specifically on ethno-racial populations and dementia. So those groups that I mentioned earlier, Indigenous, Black, Asian, and South Asian, she's looking specifically at prevention and lifestyle factors. Actually, an area that I want to get into later. I think Black people want to move on to prevention lifestyle factors. We don't always want to hear the doom and gloom. I think my study was important because it was about experiences, but I also want to move on to prevention and lifestyle factors. What can Black people do now to engage in different activities, different initiatives to prevent dementia through lifestyle, throughout the life course? So Dr. Laura Middleton, she's done many studies. She's a real expert on this, but she hasn't necessarily before focused on ethno-racial populations. So she's currently doing a study that I'm involved in and Andrew's involved in, and a few key ethno-racial folks who are in the dementia space. They're helping to lead this research to look at prevention and lifestyle factors. As I mentioned earlier, we have a term when we talk about dementia called modifiable risk factors. These are things that can be modified, and things like diet and exercise and smoking and drinking alcohol, etc., modifiable risk factors, and they connect to lifestyle factors. How can we get Black people to be more aware of dementia, but more aware of what they can do to prevent a dementia, which I think, once again, very important for me to get into that space. I also, as I said earlier, I am doing a digital storytelling project or a documentary film on dementia. I hired a Toronto filmmaker to do this a few months ago. It's based on, of course, my study, and it has 4 separate videos. The first one would be with me and my co-investigator, Lydia Capareri. She's in health and aging at McMaster. We co-led this research. That first video would be about us talking about our study and the findings, and I will give some context in terms of how I came to this topic because of my mother. That would be the first video. The second video would be the persons with dementia, Black people with dementia, and they already filmed their scenes, and they were participants in my study. So they were the Black participants in my study. We got 3 people to agree to be on film to talk about their experiences. The next video would be the care partners. So we got some folks who have family members, Black folks with family members with dementia, who spoke on camera about their experiences with dementia. And then the fourth video would be focused on the landscape of care around dementia in the Greater Toronto and Hamilton area. And Ngozi Irona, who is at the Alzheimer's Society in Toronto, she looks at health equity. She's doing some really fantastic work on health equity around dementia. She's going to appear in the fourth video to talk about the landscape of care in the dementia space, the landscape of care for Black folks, culturally competent services around dementia that exist in Ontario or the Greater Toronto and Hamilton area. So she will be in the final video. She also has personal experience with dementia. Her father had dementia, and he recently passed away. He passed away in May, unfortunately. And another care partner who's featured in the video, her mother passed away with dementia about 3 weeks ago. So a few of us have had that experience. And I know myself and Ngozi from the Alzheimer's Society, we are also going to touch on our own personal experiences. We want to bring this home to people who will look at this video, particularly Black folks. The other kind of next step is that I plan to move ahead with future studies on dementia, which means that I need to apply for grants, of course. There's a grant from the Alzheimer's Society of Ontario. There are different grants, CIHR grants, which is a health academic grant. So I'm going to look at that shortly. Right now, I'm just trying to figure out what is it that I want to do? What is it that I want to look at? I've looked at experiences already. And as I said, I'm interested in prevention and lifestyle factors. So that might be the next step, or focusing on the care partners. I went to an event a few months ago focused on care partners, and they're often forgotten. I know as a care partner myself, it was rare for anybody to say, Ingrid, how are you doing? Right? Care partners want to know that people acknowledge them. Yes, it's important to acknowledge the person with dementia, but care partners can be very stressed out. And often people don't check in, which is what I found. Or they don't say, how you doing, Ingrid? How you holding up? And you just want to get some acknowledgement at times. I think care partners have a lot to say. I think they have very important experiences. And maybe at some point, I want to focus on the experiences of Black care partners. So I'm just looking forward to what's to come in this dementia space. I'm passionate about it because of my mother. This was never a topic of interest to me before my mother. My mother had to deal with Alzheimer's, but I find it through my mother and looking at my mother, I found it to be a fascinating, mysterious, disease that I wanted to get to know. I wanted to understand it. And the reason I did my study was to help my mother, actually, because I thought it was so fascinating and so mysterious, and I didn't know what to do. And I thought maybe if I did a study, I will learn more about it. I will understand how to take care of her better. Um, Unfortunately, she passed away last year, but I want to continue in this space because I think it's so important. We have an aging population. I think because dementia is often not seen as sexy as other illnesses, it doesn't get the attention it needs. And certainly for Black folks, I think we need to start talking about this more. So I'm passionate about this area, and I will continue to do what I can to move the conversation forward. I would like to thank you very much for listening to my presentation.
Great. Thank you so much for that presentation. Really a lot of valuable information in there, a lot of information for us to consider. We had a couple questions already come in, so I'll just share them with you. So I think so. One of the first ones was, how can we view the documentary?
The documentary, like most of my documentaries, will be free because I want it to be accessible. Um, what I've done with a few of my documentaries is I've posted it on YouTube. So I will post it on YouTube and then share it on social media and then send it out to different organizations and different professionals. So that's
Great,
the best way to view it on social media through YouTube.
great, and that'll be a resource that I'll hope to leverage as well when I'm connecting with folks in community. With this work that you've done, I've used the presentation and the report
Yes,
to highlight some of the information that you found there.
thank you.
Somebody else had asked, why is Alzheimer's/dementia so difficult to diagnose early?
Uh, that's a good question because I think some of the symptoms don't appear out of the ordinary. And it also comes on in a very subtle and silent way. Um, and also, we're getting to learn more about dementia. And I would also say that for some folks who aren't aware of dementia, particularly, I would say Black folks tend to get diagnosed at a later stage. I think that's found in existing studies. They're diagnosed at a later stage because their family members are less aware of it. So there's always this kind of joke. It's not really a joke when we're talking about dementia, but with Black folks or Caribbean folks, they will say, like if somebody is forgetting, they will say, she's just forgetful, no big deal. There's
Hmm.
an undermining of memory loss. We will say, she's just forgetting, no big deal. They scratch it up to being elderly. So there's a not taking seriously symptoms that that are showing itself in very
Hmm.
subtle ways. Um, so I think that's one of the reasons for many people. I think for people who or communities that are less aware, like I would say Black folks, it's a kind of dismissing of very subtle symptoms that you will see, scratching it up to being old, dismissing various issues like memory loss, and thinking it's a natural stage of life.
Hmm.
So by the time I've heard this, I've seen this in studies, Black people go to get diagnosed. I would say, well, nothing's ever too late, but it's at a later stage where things are much more serious because nobody noticed it at home. So that's one of the reasons.
Hmm.
I wouldn't put the blame on the healthcare professionals necessarily, although this is an emerging field, I think. We're learning more about it. I would say the people around that person with dementia, family members, friends, might dismiss key signs.
Hmm. Thank you.
Um, for me, um, with my mother, I noticed very strange behavior. I didn't know what it was, however, until a social worker came over to my home, or to my sister's home, sorry. That's when she was diagnosed, when she was in Ottawa, and said, Your mother has Alzheimer's. She did a lot of strange things, like, well, there was a point in time when she was just falling. She fell
Mm,
outside a laundromat, and somebody had to pick her up. I don't know if the falling had anything to do with dementia, but that was the start of a lot of strange things happening. And she started to, like, she would take her toothbrush. She would take a toothbrush and tie a rubber band around it and put it in her purse, right? And I thought, wow, that's strange. I was looking at her and I would say to her, "What you don't do with people with dementia, you don't argue. This is what they say about dementia. You don't argue with them. You just make it look like everything is okay." But I would
mm,
kind of say, Mom, your toothbrush doesn't go in your bag. Why don't you put it in your bathroom? Because you're gonna need to brush your teeth. And she would look at me angry, right? That happens with dementia. They would say, they start arguing with you. No, my toothbrush goes in my purse, right? She would argue with me. And I would say, no, but it goes in your bathroom so you can brush your teeth. But the tying of her toothbrush with a rubber band and then placing it in her purse, I said to myself, that's strange. What's going on here? I also noticed that she would open her closet and stare for 10 minutes, just stare into her closet at nothing. And I started to get really worried and scared. Um, she went through a stage of paranoia. Everybody was stealing from her.
mm,
The caregiver stole her white sweater. Everyone was stealing. So I went into her closet. The white sweater was hanging there. And I pointed. I said, The caregiver did not steal your sweater. Your sweater is right there. And she didn't say anything. She probably felt a bit embarrassed. So she went through some definable stages that were all very strange. Those stages will then stop and she'll move on to another stage. One interesting stage was taking her shower cap and putting everything in it, her deodorant, her underwear, her cream in her shower cap, and then taking her shower cap and placing it in the middle of her bed,
mm,
and then sitting down as if nothing had happened. And I thought to myself, that's strange. It was like she's taking everything, placing it in the shower cap, and putting it in the middle of her bed, sitting down and watching TV. And I didn't understand that. I At that time I thought maybe this is a sense of control that she was needing as a person with
right.
dementia. I don't know what it was, but to this day, I think back to all the stages she went through that that happened for like 3 weeks and then would stop and then she would move on to another stage, right? So for me, there were kind of clear signs.
Hmm.
My mother was a rational person, as I said, joyful, loving, sunny, bright, personable. Everybody loved her. I always said she had a talent for people liking her, which which was really something. And to see these subtle changes, for example, as I said, me on the bed with her, and I was completely cut off. Where in the past we would joke, but she was like in her own world. I noticed these changes, but it's not always easy to see them, right?
Yeah.
And particularly for family members who initially aren't living with that person, it's very difficult to see it. So I would say try not to dismiss some of these subtle shifts.
Hmm. Thank you. Someone else had asked, from when you were connecting with the care partners for your research, what were some of the biggest challenges that you heard from those care partners? So what are some of the biggest challenges that Black care partners face?
Um, One of the things that we talked about was what the funder wanted us to look at in getting the funding for this was to look at COVID. So the person caring for a person with dementia, what challenges they experienced venturing out of the home and seeking health care in the midst of COVID,
Mm,
and mobility issues. being able to be mobile in the midst of COVID. So I think many of them talked about how difficult it was to care for the person with dementia in the midst of COVID, because of course we were on lockdown. And so that was very challenging. It was also challenging for the person who's taking care of the person with dementia, because the person with dementia who was formerly very active and going outside the home was no longer able to do that. So there was a frustration in the home that the care partner was experiencing as well. So I think COVID was the issue, the lack of mobility, the shutdown, the challenges seeking medical care, and the fact that the person they're taking care of was formerly active. If that person was still walking, of course, with dementia, you can end up completely disabled. Unfortunately, that was the case with my mother. My mother, towards the end, could no longer walk, right? So she was
Mhm.
bedridden. So we did everything in the bed. We shampooed her hair, we bathed her, we fed her in the bed. But for the person who is still walking, and who was active and engaged in outside activities, the frustration of that, of not being able to venture out, took a toll on the care partner, who was not only dealing with that emotion, but was also dealing with, how do I best care for this person when we're in lockdown? That was the biggest, I think, challenge that I heard.
Good.
For some care partners, some of them were actually the romantic partners of the person. So they talked about, they kind of lamented being the kind of romantic partner of that person with dementia and what they had lost emotionally and in the relationship, and the
Mm.
distress and the depression that they were experiencing because their romantic partner had changed and was impacted by dementia. So I heard from many romantic partners about that loss.
Thank you. So we've got a lot of questions in the chat coming through, but unfortunately we won't be able to get to all of them. So we have the we'll have our folks put in our contact information into the chat, and we'll capture some of the comments that are there, and we hope to continue the conversation. But just want to thank you again, Dr. Waldron, for coming on and sharing your knowledge with us. Really appreciate that. And
Pleasure.
so,
Thank you.
absolutely. And so we're gonna have a poll pop up on the screen in just a moment. So we'd ask you to take a moment to fill that out for us. And so again, I'll just say, just as you're filling that out, that you'll see in the chat there, you'll see our 1-800 number to our dementia helpline. So we would invite anybody with additional questions. Feel free to give us a call at 1-800-611-6345, and we'd be happy to chat with you. And so as we're closing, just want to thank everybody for tuning in today and joining us for this conversation. Please continue to send us your comments, your questions. Feel free to contact us on the helpline if you're looking for support for supporting somebody in your family or in your community with dementia. We'd be happy to connect and work with you. So this session was recorded and it will be hosted on the ASNS YouTube channel in the future. So you'll be able to review it again. You'll be able to share with your family, friends, and community, and use it as a teaching tool as well. And it will also be, I think there will be a link sent through email as well. So just want to thank everybody and take care.
Thank you. Bye bye.